we welcome to the virtual floor the equally talented team of Dr. Rose Angela Mahipus and Dr. Adeline Bea Bernaldez to present their research. The virtual floor is yours.
Good afternoon, doctors. I am Dr. Rose Angela Mahipos. Together with me is my co-author, Dr. Adeline Bea Bernaldez. Allow us to present to you our research study. Dengue, a mosquito-borne tropical disease that continues to contribute to our country's healthcare concerns. Even in the face of pandemic, this disease continues to show up every now and then, adding up to the burden of limited healthcare supplies. There have been multitude of interventions recommended by various groups, including the WHO, which focused on vector control strategies. However, it was suggested in previous studies that these traditional strategies were not enough and that community-based programs must be incorporated in order to successfully control and prevent dengue infection. Our research study delved on the effectiveness of community-based programs in dengue prevention. The objective was to determine the effectiveness of community-based programs through acquiring related researches and appraising their validity systematically and objectively for review. This review is deemed useful to family and community physicians in their implementation of dengue control programs in the community. A systematic review and meta-analysis of randomized controlled trials was used. Out of 32 studies that were initially identified, 11 studies were included by the review authors. A computer software, Revman version 5.4, was used for the statistical analysis needed. All the included studies were encoded, and the effect of the interventions were estimated using odds ratio for the different measurable dengue indices, along with an encoded 95% confidence interval. This table shows the details of the 11 studies that met our inclusion criteria for this review. These studies implemented interventions and measured impact at the cluster level. For the risk of bias assessment, the studies had low risk of bias in terms of random sequence generation and reporting bias. The highest risk of bias across the studies was the non-blinding of the participants. For the results of the study, using dengue indices as the outcome of measure, it has been found that the community-based programs used in the included studies were generally effective in preventing dengue. To discuss in detail for the house index, there were 7 out of the 11 included studies considered. Majority of the results showed that there were lesser percentage of houses positive with larvae in the intervention group as compared to the control group, which mean lesser incidence of dengue and that the more effective the intervention used. As seen in the direction of the individual plots, the odds of success or having a good number of house index were lower. In the analysis of the study's consistency of results, a homogeneity test using Cochrane Q test revealed a chi-square of 13.11 with a p-value of 0.04, with associated I-square of 54% showing that there is moderate heterogeneity in the results of the study. The overall summarized odds of success of the intervention had an odds ratio of 0.83, suggesting the effectiveness of the intervention used. The odds ratio also had an associated overall effect with a z-score of 2.23 and a p-value of 0.03, indicative that the effects were significant at 5% level of significance. For the container index, most of the studies considered in this outcome showed lesser percentage of water-holding containers infested with larvae in the intervention group, which mean lesser incidence of dengue and the more effective the intervention used. Furthermore, as seen in the direction of the individual plots, the odds of good container index scores were lower among most of the studies. In the analysis of the study's consistency of results, Cochrane Q test revealed a chi-square of 32.38 with a p-value of less than 0.01, with associated I-square of 81% showing substantial heterogeneity in the results of the study. The overall summarized odds of success of the intervention had an odds ratio of 0.61, suggesting the effectiveness of the intervention. The odds ratio had an associated overall effect with a z-score of 5.04 and a p-value of less than 0.01, indicative that the effects were significant at 5% level of significance. For the Breto index, the studies included had varied results as to the number of positive containers per 100 houses inspected. Some studies showed lower Breto index in the intervention group, but there were also quite a number of studies which had more favorable results in the control group. As seen in the direction of the individual plots, the odds of good Breto index scores were dispersed in terms of odds of success among the studies. In the analysis of the study's consistency of results, Cochrane Q-test revealed a chi-square of 73.38 with a p-value of less than 0.01 with associated I-square of 88% showing substantial heterogeneity in the results of the study. The overall summarized odds of success had an odds ratio of 0.92, suggesting an equivocal effect. Although the odds ratio had an associated overall effect with a z-score of 1.33 with a p-value of 0.18, indicative that effects were not statistically significant. Putting into consideration the moderate to substantial heterogeneity in the included studies, a subgroup analysis on the different interventions used, namely environmental manipulation, human behavior, and environmental modification was done. The results showed that environmental manipulation had a greater effect towards dengue prevention as compared to human behavior alone or in combination with it. The two studies included in this subgroup analysis were by Kroger et al. And Mendoza et al. The former used curtains and water container covers treated with insecticide, and the latter used long-lasting insecticidal house net screens in combination with targeted treatment of the most active Aedes aegypti breeding sites. The odds ratio of the dengue indices in the above-mentioned studies were less than 1, which means that environmental manipulation interventions used were effective in preventing dengue. Results of the studies were found to be statistically significant with a p-value of less than 0.05 except for the container index. On the other hand, in the subgroup analysis involving human behavior, the results were equivocal except for the container index. While in the subgroup analysis involving both human behavior and environmental modification, the results were also equivocal aside from the container index, which favored the control group and showed that the intervention used was ineffective. However, the overall results showed that it was not statistically significant. In conclusion, environmental management as a strategy to prevent dengue is effective when it involves the participation of the community. From the three different types of environmental management, it is those studies that made use of environmental manipulation with community involvement that had greater effects when it comes to dengue prevention. This could be due to the fact that environmental manipulation directly targets the quality of established breeding sites, which would mean less chances of reproduction and eventually control the number of vectors. The participation of the community is important in carrying out this strategy so as to detect and target more vector breeding sites and to ensure a more sustainable strategy in controlling and preventing dengue. The review authors recommend to use community-based programs as a strategy to help prevent dengue. Capacity building through community empowerment is a must in areas where dengue is seen as a health threat. Members of the community must be educated, equipped with knowledge and practices that contribute to dengue control, as environmental management can only be as effective if people in the community are willing to participate and have the desire to maintain good community practices. Thank you and good afternoon.
May we again give a virtual round of applause to our presenters, Dr. Mahipos and Dr. Bernaldez. We now open the floor for question and answers from the Board of Judges and invite Dr. Mahipos and Dr. Bernaldez to stay on.
Okay, good afternoon. Thank you for your presentation, Dr. Mahipos and Dr. Bernaldez. So your research is very much relevant, especially nowadays na meron na po tayong di ba, tag-ulan na, napaaga ang tag-ulan natin, prone tayo magkaroon ng dengue. And at the same time, di ba nga ang ating profession ay family and community medicine. So yan. So based on the results of your research, what are the things that you recommend to do, no? Anong best sa results ninyo? Anong plano nyong gawin, maybe at the department level, community level, and one siguro is a policy level. Anong ma-advise nyo based on your research results?
Good afternoon again, doctor. So based on the results of our study, doctor, this could be used as a scientific evidence for our members of the community to be presented by fellow Filipino family physicians and community physicians, as it would help really to increase their understanding and perhaps participation, seeing that it is really effective when a certain program is community-based as opposed to doing it alone. So this research study of ours can be used by our fellow doctors to promote or improve the participation of the community members, especially at this time of pandemic, though there is a challenge when it comes to face-to-face interaction. We are blessed with the technology, the gift of technology, which could also be used also to increase the awareness of the people in the community. One policy that we could perhaps suggest is to strengthen further the 5S strategies that are being already implemented or introduced by the Department of Health. What needs to be done is, I think, is strengthening of this policy, of this program, and to make the members of the community see the salience of the problem, especially if their area is a dengue prone area. So that's about it.
Good afternoon, doctor. So just to add to Dr. Mahipu's statement regarding the results, the application for the results of our study, we can suggest that for policy making bodies, aside from strengthening the 5S strategy made by the government, it is clearly stated in our study that there is no one size that fits all. So what we are trying to say here is that whatever the community does doesn't matter really, but what matters is who does it. So we need to really strengthen capacity building, and at the same time, we should recognize that the stakeholders' participation, just what was mentioned in the Alma Ata, a declaration wherein the health should be in the hands of the people. So I guess we should do more of that strengthening of and empowerment of our community. Thank you.
Okay. Thank you for your answers. Just a follow-up question. Moving forward, looking forward, what particular challenges ang na-anticipate nyo just in case you apply those policies or yung mga actions na nabanggit nyo kanina?
The challenges, doctor, when it comes to presenting these policies is that do you call this, the lack of one challenge would be perhaps the lack of information when it comes to dengue in the community, because although there have been a lot of programs already, if people are not interested in it or didn't see the challenges or the disadvantage of not learning about it, then the problem would be is their participation. They will not be that committed to our policies that we want them to also to practice in the community. So that's about it, doctor. Would you like to add, Dr. Bernales?
So aside from the mentioned knowledge gap by the people in the community, doctor, we can also include as part of the challenge the cultures and tradition that the people in the community could be practicing. So as we all know, a lot of people are not really making use of nets anymore. So maybe this could be a factor or a hindrance in doing a community-based intervention, especially that we are moving more on a higher technological advancement. So maybe that could be a challenge, doctor. Thank you.
Okay. Thank you.
Thank you very much, Dr. C, and our presenters, Dr. Mahipos and Dr. Bernaldez. We're sorry that the other judges can no longer ask questions as the 5-minute mark has been reached. So thank you very much for your presentation. Again, this is a presentation that requires environmental modification. So beyond just our clinical care, we have to look also at the context of the families and modify their environment. But yung important emphasis ng ating researchers is that they should also have community involvement. And that sometimes can be the challenge. Even if you offer them the tools for environmental modification, if you don't learn to coach and mentor them and travel with them so that they will be able to adapt this, that will be a challenge that family and community medicine practitioners face. Before we proceed, so thank you again to both. Before we proceed to the fourth presenters, we hope that our audience, so we are more than 400 already, are really looking not only at the research per se, but the recommendations that can be gleaned from the research that will be able to be applied to enrich our population-based interventions. We hope that you are all taking note of that, especially those who are really working at the municipal health office level, provincial health office levels, and in your own private practices.